Aloha, my name is Josh Green. I'm running for Lieutenant Governor for the state of Hawaii. I came to Hawaii to be a physician with the National Health Corps, and working as a doctor on the Big Island, I saw our greatest challenges over the years. One of them is homelessness. As a senator, I've seen that problem in the last 10 years explode here on Oahu. And I'll tell you, it is what I hope to take ownership of as Lieutenant Governor. I've already begun to address the problem in a way that's a little bit different than anywhere else in the country. We know that we have about 8,000 homeless in our state. Of them, about 20% are chronically homeless, and that means that they are homeless for more than 6 months. There's a lot of, unfortunately, drug addiction and mental health issues. These are the greatest problems that we as physicians see. In order to get people better, we need to provide health care. A very small percentage, about 3.5, 3.6% of our people consume 61% of our health care dollars. And the homeless who are in that group constantly have to go to the hospital, go by ambulance, go to the ER, and they remain homeless. Even if I could take care of them in the hospital, they're homeless again the next morning. The problem is we haven't had adequate health solutions and housing both. So I've started a concept called H4, which is hygiene services, acute health care, urgent care, medical respite, that's our third H, and then the fourth H is permanent housing. The moment we give people a roof over their heads, their costs drop 43%. And that's money we can invest in permanent housing, we can invest in shelters, that we can invest in healthcare. By providing those services through my model and through the model that I'm working with Queens and the Chow Project and IHS and the doctors across the state, all the care coordinators and social workers, that's how we actually solve this problem. So if I'm chosen as Lieutenant Governor, I will take ownership of that problem and the opioid addiction crisis. Of course, there's a lot of opioids out there in the community. A lot of the homeless, again, are hooked on drugs, and we need to get people better. We shouldn't be putting people in prison, and God forbid people should not be living on the streets, especially if they have these health challenges. So I intend to open about 6 clinics. I've already opened one in Chinatown. They're free clinics, paid for by the private sector, partnership with the government, that will actually make a difference on this solution. So I hope that that's what people will see in me as Lieutenant Governor. That's how I'll address the core part of the homeless crisis. We also have to build a lot of units. We've got to do housing first, and we got to all work together. Thank you very much for focusing on this problem. It's a heartfelt problem and a challenge that we all have to step up on. Thanks.